So our next speaker is Dr. Jennifer Black, who will be speaking and sharing insights from the Emerging Hungry Stories Project, an initiative that brings artists and health researchers together with the goal of making art and writing stories that will get people talking about food insecurity and what we can do to make sure no one ever goes hungry in Canada. Dr. Black is an associate professor of food, nutrition, and health in the Faculty of Land and Food Systems at UBC. Welcome.
Oh, fantastic. Hello, everybody. Thank you so much. I wanted to really just start by saying how grateful I am to be a visitor on these traditional, ancestral, and unceded territories. And in particular, just wanted to thank UBC Health for including me in this inspiring group of speakers, and also for the funding from the Health After 2020 funding that really helped catalyze this project that I'm going to talk about, which fundamentally asks the question, what are our roles and responsibilities as scholars and academics working on the topic of food insecurity when we have a mountain of evidence, but really very little action and change using that evidence? So just to set the stage, there's really three things I want you to know about food insecurity before I talk about the Hungry Stories Project. And when I say food insecurity here, I'm using that term to mean unstable or insufficient access to food, really because of financial constraints, really not enough money for the foods a household needs. So the first thing I want you to remember is that we have excellent national data that tells us that, unfortunately, food insecurity is a long, festering, major public health problem in Canada. You can see from this map that the numbers are really shameful, that now over 8 million Canadians report inadequate access to food because of financial constraints. What we also know is that food insecurity is a major public health crisis problem that results in mental health consequences, physical health consequences, healthcare costs, as well as increased risk of death. And while the major strategy we hear about to take action on food insecurity is charity or emergency responses to food insecurity as our main, really, policy in action. But when we look at data that you can see here that looks at the difference between the number of people who report using food banks in Canada, which is already astronomically high for a wealthy nation like ours, in our best data we have about annual usage, we know that those numbers are growing, and over 1 million Canadians in 1 month are relying on food banks. But it's a drop in the bucket compared to the millions of more Canadians who still experience food insecurity, who never have access to a food bank in the first place. And we know among those who do have access to charity means, it's woefully inadequate for meeting the giant gap in their budgets that's needed to actually alleviate food insecurity. What we do know from 40 years of research about food insecurity in Canada is that we need much more systematic, structured policy responses that can meaningfully address the underlying material deprivation and poverty that underlies food insecurity. So while we think of food as the system and sort of the thing we see, food alone can't solve the underlying issues of lack of income and resources to meet basic needs of Canadians. So what do we do when we have loads of evidence and little change? So just to let you all know, we have excellent data collated by our colleagues at the Proof Food Insecurity Research Institute from the University of Toronto. Year after year after year, they've been writing excellent policy reports because we have for 20 years been documenting the only rising rates of food insecurity we see in Canada. We have peer-reviewed paper after excellent peer-reviewed paper after excellent peer-reviewed paper, but when we look at the language that our colleagues are using, while the evidence is robust and rigorous and compelling and reminds us that we keep saying that our best answer, we keep being sort of stuck in the discourse of charity as our only response, even though we now have evidence that we can do better, a group of scholars and artists got together in this project to ask, well, what messages are we actually telling the public and our own kids and our own communities? Because the research evidence has clearly not translated, perhaps beyond the halls of our own conversations, but it's clearly not the discourse that is happening every day around what we really need to do to change things. So I was really struck by this question when my own small kids started school. They go to this amazing school that's socially conscious and wanted to get them as active citizens. And they were, being they were seeing the kinds of imagery and ideas that you see in these slides, that we can make a difference, we can fight hunger, one more can, we can do it, we'll feel great, we'll celebrate, we'll stuff a bus full of food, and we will help other families in Canada reduce their exposures to food insecurity. When we looked around at what children's books were saying, we found books like Emma and the Food Bank, who sort of celebrate food banks as a solution to food insecurity, and children we suspected these were the message they were getting. But as the scholars we are, we teamed up with Diane Day, who was then a PhD student, who did a rigorous analysis looking to ask, well, if we look at any book for middle school readers, what would those books say when they looked at any books that had food insecurity experiences among the protagonists in those books? So first I asked yourself, can you even think of such a book that tackles food insecurity in children's literature? We were able to find 25 of those books. And we asked, what were the messages they were sending children who were themselves looking for reflections of their own experiences in literature, or others who were looking to learn what is the world like and how do we see ourselves and the stories and the truths that we know from research in books? And what we discovered was among these 25 books that showed food insecurity at all, children's hunger was always resolved, but usually by some scrappy parent pulling themselves out of up by their bootstraps, or by good luck, or by individual change, or the kindness of a kindly stranger. So all of the books had told the narrative that hunger could be easily resolved, but it was always through individual change and the kinds of systematic, real, meaningful social change and policy change. We just couldn't find those kinds of stories in the books that children were reading. So, naively as we are, a group of scholars and artists got together and we asked, could we actually flip the script and write our own children's literature that would better reflect what we know from 40 years of research evidence? Now, the first draft was written by food and nutrition academics, and what we learned from that is we alone should not write children's literature. That book was very boring and very unreadable by children, though extremely educational. So we were able to get together with real authors and artists who could take that important, rigorous scholarly work and turn it into a story that hopefully your children and neighbors and friends would want to read, that didn't, oversimplify or save the children, but we're hoping is a story that will get kids curious about the experiences that many kids in Canada are going through, why we are in the situation we're in, and what kinds of bigger kinds of changes and advocacy and thoughts and ways forward might we want children to be thinking about. And we're going to put the educational stuff in a nice little side resource packet for educators and parents who can then help have those conversations. So where are we now? We have now launched officially the Hungry Stories project and an emerging website called hungrystories.ca. Visit it if you want to check it out. Even since the slides were sent to Tio and Brenda last week, it's very exciting for us to announce we actually now have a publisher, the Second Story Press out of Toronto, who's actually now going to publish our graphic novel that we're now calling Stuffing the Bus, A Hungry Story. Just the snapshot is, it's the story of friendship between two children, both who are living in sort of financially precarious context, one of whom is really experiencing a more severe level of food insecurity in their household. And these are kids trying to understand the world. They're trying to understand neighborhood cats. They're trying to write comics and be kids and be joyful and understand their world. The plot starts when their class has a Stuff the Bus challenge, which maybe your kids' schools have, where kids are competing to stuff as much canned goods as they can in a bus. And the story ensues. So we hope by 2026 that book will be available to the world. Until then, we're trying to populate this Hungry Stories platform. We're not creating the knowledge and the tools. Much of that does really already exist in other platforms. So we're hoping to become a hub where artists and scholars can, and citizens and kids and families can find resources they need to have these really complicated, difficult conversations, because we want our kids to be generous and thoughtful and help each other out, but we also want them to be getting the truth about what is actually meaningfully going to change the dial about food insecurity. And we know just continuing to tell kids another can in the bin is going to do it has not led to any meaningful change on the kinds of numbers I showed you at the beginning of this talk. So going forward, our first big step is to finish the graphic novel that's now really on its way. We keep applying for funding to move this work forward, both in terms of the web-based platform, but also thinking about other ways artists and scholars and communities affected can get together to translate knowledge more effectively. And really thinking about how do we know if we're making a difference. And part of what's so important about the work that UBC Health has done with all these projects is helping us envision an idea of what is real scholarship that might be different than some of the more traditional ideas about just doing a study, publishing it, and moving on. So some of this is just really convincing us that this is real work, and maybe this is a big part of our roles and responsibilities as scholars and trainees and health professionals, to not just learn and do the research, but also figure out how to use it in a way that contributes to meaningful change. So I really just appreciate being here, and thank you all so much.